Today we have a fantastic story to share. Renee, can you unmute yourself? Renee, how long have you been using the patches and what makes you started using the patch?
11 months. Started using the patch because of my mom.
What happened to your mother?
She injured her lower back. She was playing basketball with my son. She was 81 this year.
How serious was the lower back pain?
I bring her to doctor. She actually couldn't sleep and she complained it's very painful. We bring her to doctor and doctor just gave her medicine. After that, she's still not well. And then so happened my husband, Kuje, Daisy, which is my upline now. She just told me that why not you try these patches? Only one small little patches can heal my mom's back. She said, you just try lah. If cannot, then never mind, just throw it away. My mom also agreed to patch. After 2 hours, my mom said, like that. So why not you give it a try? We bought a silver package and me and my mom tried together because I want to see how effective, how amazing the patches is.
During that time, the doctor asked your mother to go for any operation? It's just a lower back pain. Just take medications only.
She in pain for a few days. I think about 4 or 5 days. Couldn't sleep at night and she really suffered. I can see she really, because she's at her 81.
At what point of time that you realize this pet really doing magic? Apart from the pain reduced, are there any other area of improvement that you say, this pet really can do quite a number of things?
I can share some photos of my mom.
Renee is a graphic designer. So you see a lot of AI and Photoshop.
This was me.
After how many months?
2 weeks ago. This is last year, April.
It's about 11 months.
My husband took the photo and she told me that if I never see the comparison, I never know that you are aging. Luckily, I met Kuje.
If you look at, I think even her neckline also become no more neckline. You can see some of the wrinkles around the eye disappear.
The pigmentation is lighter actually with the Alavida night cream.
And then you can see that the laughing line used to be quite deep. Now the laughing line also disappear. If don't see you right now, I see last time, I can see it's 40, 50 plus years old. But now this one look like 30 plus years old. Do you think that it's really 30 plus years old?
I can feel more energetic.
Even looking at your mirror also make you energetic. Wow, it's amazing. And apart from the look, in terms of your body, your menstruation, your sleep, your hair, your nail, do you see any good changes?
My menstruation actually, before that, 2-3 days, then my flow is getting lesser. But now after patching, right, my flow is actually prolonged to 5 days.
This is a sign of age reversal. That means as you start to see your menstruation blood volume getting less and less, it's normally people think that it's going to menopause. But now you see the volume get back more. It means that you are reversing. Apart from you and your husband, did anyone say that, wait, Rennie, how come you look so different? Very younger version of you already. Let me see.
My mom. Can see here on the beside, this is before and this is after. You can see her wrinkle actually, and you see here this part, and she also put on weight. It's very hard for her to put on weight. She also built muscle on her leg because my mom is very skinny. Before my dad passed away, she was only 9 kg. She's 18 and now she is 42.
kg is a lot for elderly.
She has very good appetite now. More meal, more often.
Do you see the fine lines around the eye region? It's really 4 months later, you can see the reduction, and you can see the cheek at beside the mouth there, right? It's sunken. They mean the collagen is lost. But now it's built back already. Do you guys see these changes? It means that there is a way for your body to build back collagen and your muscle by patch. A lot of people, if they get slimmer, what most people do, they will drink more protein powder, ask them to put on supplement. At the end, it burden the liver even more. But now with the patch, you build muscle. It's counterintuitive. We think that you need to eat more protein in order to build muscle because you don't have the idea of organ function.
For my mom, she don't really take supplements.
You see, who say you must need supplement to build muscle, need protein? You just need the right organ function. Your body is able to digest the normal food. You can build this already 81 years old. When your siblings look at your mother, how come
yes, especially my brother and my sisters will like, what happened to mama? What do you do to her? I said, I give her the patch and then they are trying there. After seeing my mom, please buy for me.
If you see the left photos, 2-4 March, you can see her neck is all very string down, very thin like this, like a turkey neck like this. You can now see on the right, you can start to see a little bit more firm already. You can start to see a bit more firm. This is all sign of
her memory.
So better. Can you Give me some example. Maybe last time she always forget things or she forget your name.
Not forgetting my name, but then certain things that she don't remember for many years. Suddenly she will ask me, where is that thing? Something like that.
They mean something that she put SMS in the storeroom. She forgot a long time, never talk about this. But after
Yeah,
putting the pad, she start to recall they were dig inside the storeroom.
correct. Even she asked me about her old friend that passed away. I remember she passed away. Suddenly I remember.
This means the cognitive function improve when your cells start to build back the link between the brain cell. This is what happens. It means that what Rennie is saying right now, either the collagen is building, the muscle is building, it means the digestion is getting better, the memory is building, the brain cell connection is building up. These are all the inside changes that reflect on the outside. Amazing.
After 2 months of patching, at her 60s, I remember she has this dermatitis,
Okay.
hand eczema, because of
Eczema.
allergy to a detergent. This is not the first time. I think at her 60, it's happened a few times. Doctor gave her a steroid cream. But
Right.
after she patched for 2 months, it suddenly appeared with a blister, and she said it's very itchy. She starts scratching. And then all this is only 2 weeks. I think this is a healing crisis. I give her one bottle of night cream for 2 weeks, and then
Yeah.
you can see that after 2 weeks, her hand until now, her skin is very smooth and very nice.
Your mother wasn't afraid when you see this flare up?
She actually worried, and then my
Yeah.
sister also said, "I'll stop patching." I said, "No, I have to let him go through this healing crisis. I believe she will recover."
Most people, what they will do, they will bring them to hospital, go and check out. Then the doctor will say something, get steroid cream, and even more problems. You say,
Yeah.
you just take the 2 weeks of faith about your body have the power to heal. Now, no more this problem. Even she go and cut vegetables, go and wash hand with detergent. Now, how the self repair mechanism of our body, when you touch something, you get allergy. It means that the area got a lot of toxin. The body is not able to expel. A little bit of agitation, it will start to flare up. So when you put the LifeWave, suddenly it got flare up is because you try to push up all the toxin have been accumulated there. You throw away all the rubbish in your dustbin right now, it become clean already. Sometimes even small rubbish throw inside, it will not fill up the dustbin. Now Kautima, 81, 82 years old, hand happy, can I believe now she can do housework, do cooking without worrying about the hand problems already. If you are using for your mother, you have to know this is always a sacrifice. If you go to doctor, you take steroid, you feel better, but the sacrifice is a long-term health for your organ, kidney failure. You put patches, so good one is you get even more itchy, but the long-term is always a plus for you.
This is my cousin admitted to ICU last year, 2024 August, because of heart attack during his badminton game in the evening at the court. He collapsed, and then they rescued him with the AED emergency kit, but he's coma, so they sent him to the Bukit Mertajam hospital. That was day one.
When he got collapsed, it means that the heart stopped already. Is this your brother-in-law used to be a healthy person, or all the while is actually quite weak already?
My cousin, he's 60, and all this while he's healthy.
Vegetarian.
He played badminton twice a week.
This is quite surprised. I think he himself also feel quite surprised. Suddenly get collapsed. Eating vegetarian is healthy. Exercise twice a week is healthy, but boom, collapse.
Yeah, nobody know why. The first day one he admitted. Second day, the family members are not allowed to visit him. So because of that, he suffered another him at night on the second day.
After the first day, actually it revived a little bit already.
Yes.
The day two, go another time, collapse second time.
But he was in the hospital in
the ICU.
And then the doctor advised to prepare for the worst because they concerned maybe another heart attack again. My sister-in-law so said, maybe kena cuci darah. Then she said, what's cuci darah? Then he said, cuci darah is dialysis. Then she asked why, because my cousin, he was unable to urinate. Then the wife said he has no kidney problem. Why you want to see the kidney, the dialysis? Then the nurse said, explained that they have followed the SOP guideline. So if they cannot urine, they have to cuci darah.
Need to do dialysis.
Have to put him on dialysis. Because we're in KL, she is in Batajam. We asked her to stop, don't do this. Because what happened to my father, same case, my father admitted they dialysis him because my father is healthy. He just got a bacterial infection. They sent him to hospital. After they dialysis him, my father just like that
Passed away already.
for 4 days.
What is the reason he need to go to hospital in the first place?
Because he cut his finger, he got infected. We did not bring him to hospital because normally you cut a finger, you just put plaster. But then this time he is serious. I was not in KL, I was in Penang that time for classes. And then my sister brought him to Sedang Hospital. Then when he admitted, that time he's still okay. I still FaceTime with him. Then he said, I'm fine. You just focus on your study. Then after that, at night, my sister called me, you have to come back because Papa is in emergency. The dialysis, he cannot urinate. I remember this in the group chat. No, we don't give Koko this cuci darah. Don't allow. Have to put it on hold because you don't sign, they cannot do anything.
You are saying the father used to be okay, and then just because of cut, maybe she feel that she doesn't feel right, and then she go to hospital. The doctor start to see very serious thing, and then realize that she cannot. Maybe because of the medication that she couldn't really urine. The doctor said according to the SOP, I don't care whether you kidney good or not, but according to SOP, no urine, need dialysis. Then he just poop, and then got dialysis, and very likely because of this caused the bacterial infection, and then just pass away like this. This is something I worry when you guys talk to me about when you poke on the lung, poke on the hole, poke on the trachea, poke on the kidney. The moment you poke, you see your kidney already weak, you still want to poke. You are making the matter worse. When did your father pass away?
2 years ago.
And thank you for sharing it to us. Hey guys, I think this is something very emotional for Renee. But Renee is bringing this out and to really tell you guys when you couldn't urine, the doctor asked you to do dialysis, think carefully because doctor only follow the SOP set by the other doctor without really understanding your particular cases. Do you think it's scary or not? The doctor can just don't look at you, look at the SOP, look at the paper. I want to put you. And if something happened to you, it's your bacterial infection, not my medical negligence. Do you think it's scary? Your kidney is perfectly fine. You are okay, nothing wrong. But because you cannot urine,
Mention to share this is because I think even in emergency, be sure to consult the doctor carefully and confirm whether any additional measure are necessary before they proceeding or considering any alternative option because the person on the hospital bed is depending on your decision to save their life. It's actually very important for you to make a decision. For my cousin, we only managed to send in the patches on day 3, 5 patches that my other cousin in Serdang, that she only has the last 5 pieces of X39. The nurse, because in ICU, in government hospital, you cannot go in like suka hati. She actually secretly go in and put the 5 patches X39 on my cousin's hand with the religious book cover it.
This is a day 1. Day 3 is they miss after the 2 collapse already.
After the day 3. And then we thought of one of our brand partner also staying nearby, Tajia and Fiona. I call her. She said she has and she also bring the beta. She said, bring beta to hospital, let the doctor read the licensing and all the pattern. Because of her, then she brought that along. The doctor go through. But the doctor actually did not scan through the beta. It's my sister-in-law insisted, and she went and print out everything and actually forcing the doctor to go through. So on the day 3 at night, right, still cannot go in. Then my sister-in-law actually secretly go in and patch the EE on my cousin's feet. And then a few pieces of X39 on his pillow. Day 4, I call Linda because I don't know what to do. So Linda advised. She actually guide us what to do, how to patch with this protocol.
That means that you were in KL. There was a brand partners in nearby the Penang. You asked her to help out. She borrow you the patches and the brochure to the doctor.
She drive all the way from Kulim to Bukit Mertajam Hospital.
Do you know Fiona before this?
I met her once. Only.
They meet is your sideline. You don't really know her.
Not really know her sideline. Linda actually helped with the patches and also teach us the protocol how to patch. Because my sister-in-law very kanchiong. Actually, accidentally on day 4, she actually patched my cousin brother the whole pack of X39.
3 pieces of X39.
And I say every 6 hours she have to change 5 pieces here and here. I just patch everything. She just put everything. Then she called me. I already finished X39. I need to get a new one. I said, you just got the whole last night, and then you told me no more already. It's very expensive. I call Linda again to lend me new patches from Linda. So Linda Lala moved all the way from Penang to Bukit Mertajam because of the X39. She patches Actually, the
30.
whole 30 pieces.
Okay.
On day 5, my cousin actually awake.
So that means maybe he accidentally did the right thing.
Because I remember Linda told me that one Japanese also did the same.
Japanese do the same thing. 30
Yeah.
pieces all put a handkerchief and put on the body.
Linda also asked us to get handkerchief. You go find
Yeah.
handkerchief. And then since
Okay.
doctor reviewing the beta 2, doctor said, if you insisted we family decision, anything happen, the hospital will not take responsibility. You need to wake up to do further scanning, something like that. Because the hospital only have one doctor that can
Right.
deal with that. So they try to transfer him to the Penang hospital. 1 week plus for him to transfer. The doctor will say, if you transfer on the way to Penang, anything happen, the family member have to bear the responsibility,
Responsibility.
not take any risk. We have X39 ambulance all the way to Penang.
You have the patches within the ambulance. Does your brother-in-law or cousin able
Cousin.
to pee?
Yeah.
Just that few hours, maybe now she's still in the
To be
hospital.
honest, we also not sure if this would work because it's emergency. Because my cousin is my father's godson. I said we cannot save Papa. We have to save him.
You and this cousin has no bloodline. Your cousin, Madajam, right? To Penang. And then
Penang.
after go back to Penang with the patch, all get healthy
Yeah,
already.
after go back to Penang, then doctor say, then he need to do the bypass. Can see here,
And then
he did the bypass. Then this
I
is what
see.
Linda taught how to patch after the
Yeah.
surgery.
Right.
Like that. It's a way to save his life.
How is him?
60.
And
He's healthy.
how is him right now? Is he still in the hospital, rehab?
Back to work.
Normal person already.
A normal person. He's going to travel next month.
Where?
I can't remember the name. Tibet.
Oh my goodness, just go a bypass, go Xizang. This one you have to let him know. Xizang oxygen very low. Your heart cannot take it, especially your heart has already got bypass.
Already told the sister.
Sometimes I do not want to help or not. Help you, how many chance Renee can help? So even you have a good cousin can help you one time, actually 2 times, because collapse 2 times and got one bypass to recover. Multiple times you being helped. You still want to go to Xizang.
But we still see him in WhatsApp every morning, greeting everyone, good morning.
For his case, I really hope can don't go to Xizang. Xizang is very thin air, oxygen is low, and the reason people got heart attack is because the oxygen is low. So your body suddenly cannot take it and then got heart attack. And now he still want to go for Xizang, high altitude, air is cold, is thin. Let's see what is the thing that is waiting for him. And
I'm grateful for the support from my brand partner across the states. In the group chat, we were discussing about this because the wife don't know what to do because she's alone. She will helpless so she asked in the group chat what should she do. We have LifeWave. Because of this, my other cousin also started using
this is a wake up call. And how many children your cousin have?
one.
How is he?
He's 21.
You not just save your cousin, you save someone's father. So since I already lost my father, I cannot let other people to lose their father. Renee, is there anything else you want to add on?
Still the same answer. When you are in emergency, you really have to consult the doctor carefully.
And just remember nowadays, the doctor also don't know they can think carefully or not. So ultimately, it's still based on your own judgment. Imagine this, if Rennie didn't stop the poking of the dialysis, just a few hours later, it's a world of difference. It can become a dialysis patient for life, even he wake up. We're thinking, what if he never wake up after the dialysis? But now, because of that one sentence, he now can go Yizang already. Do you think that this is what we mentioned? The information, you have the patch already, but you need the brain, you need the education, you need the lesson. And just now, at the nick of time, Rennie provide the lesson from the experience to the patients, or else it's going to be a world of difference. Thank you so much. I'm going to do a summary for you guys. I really don't want you guys to take this lightly. What Rennie are sharing just now is this. Of course, the mother gets so much of result. She got so much of result, but at the nick of time, in a situation like this, normally we only can learn by experience, learn from the pain, but actually don't need to. We have someone suffer from this. You just have to step up to share your information. This is why people like Rennie willing to step up to share that don't go and poke. And luckily, and the good thing happened. The patient got collapsed. Collapse means the heart stopped. Do the LED, recover a little bit, but go to second collapse. The heart stop again. They mean 2-time collapse. In the doctor eye, it's very less hope you are going to revive again already because the heart get trauma consequently. So what we do, only put the patch, let him to hold the patch. Is able to see some result already. just a few hours later can start to pee already. So luckily with the patch, with the Renee advice, able to pass through to avoid risk of bacterial infection because of the poking for the dialysis. And then we continue to put more in a very nick of time. So this is what we can do. You use the CRP, the energy enhancer, day 1 to day 5, or you put the 5 pair at one go. And dire condition, you can always put 30 pieces. You don't need to ask where is the exact location. You patch whenever there is space. You just put whatever agar paste. Everyone, you will have your own 6 sense. You distribute the 30 pieces of X39 around, most common acupuncture point. Even you have no idea, it's okay. Just patch around anyway. The next day, just wake up miraculously. You think that in this time where the doctor say you have no hope, you have heart attack collapse for 2 times in the world, there is a stickers like this, 30 pieces less than about 500 ringgit, is able to save one life, to save a father with only the 500 ringgit. Do you think that this is magical gift and other planets? Think about this in terms of the price. Energy enhancer maybe 200-300, maybe S9 500. We say 800, okay? Ringgit for this 1 to 2 days time can save a life. Do you think it's magic? So we are going to continue to give this kind of educations. So we have the patch already. We know it's definitely is working. Now is how we can add on with more education for you guys so that you can empower yourself with confidence to guide the people around you where they are still unconscious, means they are so unaware about what is going on. Imagine this. You are vegetarian, you are working, exercise very healthily in healthy lifestyle, and yet you got collapse for 2 times. It means that definitely there is a sign before that is telling you maybe you have to take certain supplement your vegetarian diet, but maybe you don't care. You think that it's okay, I can ride you through, I still can play badminton, I'm healthy. But when the thing happen like this, something is not right. When you have a chance to recover again, you want to go back there again. So this is what I mean. If we can have more education, more elevate more clarity and consciousness, right? This is what Life Changer is able to do. LifeWave patches from David Smith. We can do the education. Anyone is in to help LifeWave to do this. They have the best product. Let's offer the best education and experience sharing for this. Patch is there. You need someone to educate. You need someone to share the information. You need someone to make this thing become a norm about healing crisis. Imagine that when you put the pad, you're very itchy. Renee's sister will say, go to doctor, take injection. But Renee said, I think it's healing crisis. So now, potaiti already. Becomes so much better. This is what it takes. Just a patch and a few lessons. We are going to take charge of our life.